BOTOX, onabotulinum toxin A, is approved to treat overactive bladder symptoms such as a strong need to urinate with leakage, urgency, and frequency in adults when another type of medication, anticholinergic, does not work well enough or cannot be taken.
My name is Margaret. I'm a registered nurse and I live in Denver, Colorado. And yes, I love to ski. Being here, we start skiing from Thanksgiving all the way until March. We ski as many weekends as we can. I ski with my husband and my son. He's only 6 and already loves to ski. I love what I do for a living. As a nurse, you're working with people who are very vulnerable. Helping people makes me feel good. I started having overactive bladder symptoms while I was still in college. I was leaking urine and having to wear huge pads. I couldn't ski for a very long time without having leakage, so I would have to wear large pads when I skied in order to stay on the mountain, because it's a pain to undress and do all that kind of stuff. Also at work, I knew where to find every available bathroom on my unit, and I would wear a lot of pads. It was really annoying. When the problem started becoming an issue, I kept going back and forth to the doctor for about 2 to 3 years. I tried medication, but the side effects were intolerable. The dry mouth, blurry vision, constipation. I couldn't handle another round. After being on medication for several months, I went back to my doctor and said, I can't do this anymore. That's when I went to another doctor in the practice, and he brought up BOTOX. He told me what was going to happen, he went over the risks and the benefits with me, and he also told me that I might need to use a catheter afterwards in case I couldn't temporarily empty my bladder completely. And I said okay. After I had the procedure, I didn't notice anything different for like a week or 2, and then it started to work and I noticed a difference. I wasn't having as much leaking as often as before. After the BOTOX, when I started skiing, I remember the first time I skied without any pads and I thought, this isn't gonna work. I'm gonna end up having to change my clothes. But I didn't. I brought some catheters with me, I threw some in my pocket, and I skied all day. Now my doctor performs the BOTOX procedure every 6 months. That's what works for me. The whole thing takes about an hour. My doctor puts me at ease the whole time. If a friend had OAB and asked about BOTOX, I would tell her my story. I would tell her what it did for me. Everyone is different, but if your OAB symptoms like urgency and leaking are not getting better and you've already tried medication, I would definitely encourage you to see your urologist and ask about BOTOX. And if I can use my story to help other people, that's part of nursing, that's part of my job, that's part of my life, and that's part of who I am.
Important safety information. BOTOX may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of BOTOX. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. BOTOX may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking BOTOX. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take BOTOX if you are allergic to any of the ingredients in BOTOX. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin products such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have an infection at the planned injection site. Do not take BOTOX for the treatment of urinary incontinence if you have a urinary tract infection, UTI, or cannot empty your bladder on your own and are not routinely catheterizing. Due to the risk of urinary retention, difficulty fully emptying the bladder, only patients who are willing and able to initiate self-catheterization post-treatment if required should be considered for treatment. Patients with diabetes mellitus treated with Botox were more likely to develop urinary retention than non-diabetics. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, have symptoms of a urinary tract infection, UTI, and are being treated for urinary incontinence. Symptoms of a urinary tract infection may include pain or burning with urination, frequent urination or fever, have problems emptying your bladder on your own and are being treated for urinary incontinence, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby, are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myobloc, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. In people being treated for urinary incontinence, other side effects include urinary tract infection, painful urination, and/or inability to empty your bladder on your own. If you have difficulty fully emptying your bladder after receiving Botox, you may need to use a disposable self-catheter to empty your bladder up to a few times each day until your bladder is able to start emptying again. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
Helping other people is very important to me. The urologist that told me about the Botox procedure helped me, and I want to help other people.